Last Wednesday, people gathered outside Norwood Hospital to express their concerns about a report that there are no inpatient psychiatric beds in the plan for the new Norwood Hospital. Ray Breton, one of the organizers of the protest, explains their concerns.
I facilitate a support group for families for the mentally ill. We meet once a month. We used to meet here at the hospital, and we've been doing that for 30 years, so we're quite involved. We're also involved in the transfer of the of the hospital from the Onaponta system to the Caritas system. So we got very much involved in what the needs were and that kind of thing. We were quite surprised when we were able to get hold of the Department of Need, the determination of need that was approved for this construction when it showed no psychiatric facilities. In fact, not even any birthing facilities. Got a lot of questions about that. And looking at it carefully, we think that Stewart here is making a great mistake.
Well, the hospital had been here for quite a while. Unfortunately, got flooded out, as you know. And here is the new structure being built. Unfortunately, the company that owns Norwood Hospital, that got approval to build a brand new structure, has been allowed to rebuild a new hospital with zero inpatient psych beds, zero capability of assessing someone coming into the hospital with a psychiatric emergency. Translation, that means there's now zero behavioral health care services in one leg of an important system, right, of mental health care. Inpatient is one of those important legs. A wide swath of communities that would depend on this hospital to provide emergency and necessary psychiatric care won't be able to access that. So already other communities have had to pick up the slack in the couple of years since the hospital was flooded out, but now there's not going to be a solution when a new hospital, a ribbon cutting takes place.
Norwood Hospital President Sal Perla was able to provide us with a behavioral health update.
Hello everybody, Dr. Sal Perla here from Norwood Hospital, and we'd like to provide an update on some services here at the hospital. First is the behavioral health update. And I think, as most people know, we had 61 psychiatry beds here on the campus, and we had amazing resources and teams. And Stewart has always been committed to behavioral health, and that is not going to change here at the campus. While the new campus is going to be a different mix, the services are still going to be provided to our communities. So on site on this campus is we are going to have 10 dedicated behavioral health beds in our emergency department, and that is so that our EMS partners can actually provide transport to us when people are in crisis and be assessed at Norwood Hospital and reside there while they are being assessed and selected for an inpatient stay if that is actually necessary. So in order to accomplish that, what we have done as a health system is we are seeking for state approval on a brand new 100,000 square foot, 4-story facility that will have 77 inpatient psychiatric beds for our region. In that 4-story building will be 2 adult behavioral health units and 2 geriatric psychiatric behavioral health units, and have the ability for room for expansion. Also, outpatient services will be included as well. Those include a range of therapies, partial hospitalization day programs, to ensure that patients remain closely connected to the care that they often need after they're discharged. This decision was made following careful deliberation about how Stewart can ensure equitable access to all of those in need of specialized psychiatric care, while also meeting the local demand for non-psychiatric services. With this process of having this new facility located just 11 miles away, It will alleviate boarding times in not just our brand new hospital emergency department, but others, and create additional space for medical and surgical units for expansion at the new Norwood Hospital. So in summary, we're very excited about being able to seek approval for this new facility that will have a total care in one building versus having one unit in a community hospital. Everything will be in one location. That way we can actually improve access to psychiatrists, mental health professionals, and other seeking types of therapies that many times is challenged when you have a single unit in a location. So we're looking forward to the day where we'll get that approval and be able to make that announcement on a construction timeline for that. Thank you.